Hey, Jenna. I think we're all good now. Everyone is here, so good to start.
Great. Well, hello, everyone. Good morning. My name is Jenna Slotin. I'm the Policy Director of the Global Partnership for Sustainable Development Data. Welcome to today's webinar. We're very much looking forward to this webinar on how has the nexus between civil registration and social protection helped or ensured inclusion during the COVID-19 pandemic. We're very pleased to have an outstanding panel today, and we're building upon the publication of a very important piece of work, a compendium of good practices, looking at the nexus between civil registration and vital statistics systems and social protection. We started off with a webinar focusing on that compendium earlier this month, and this is the second part, zeroing in on the circumstances around the COVID-19 pandemic and looking at how this nexus has enabled those countries that were featured in the pandemic to address these issues. We at the Global Partnership for Sustainable Development Data are really excited to be working with the International Development Research Center and the Center of Excellence for Civil Registration and Vital Statistics Systems to share this webinar today. First, I'd like to start with a few housekeeping items around this Cradle platform. So we're very pleased to be on Cradle today because it allows us to have simultaneous translation. So I wanted to first orient you toward how you can switch languages. And I have my faith that our translators have been already translating while I've been speaking. But if you look in the bottom left of your screen, you will see a menu with an arrow. If it is set to floor, that is the language of the person who is speaking. So for the moment, that's English, and that's the language of the speaker on the floor. But if you open it up, you will see other options, including Spanish and French. So if the floor speaker begins in Spanish or French, and you wish to switch to English, you'll flip to English through that menu. And if you would like to listen now in French or Spanish, go ahead and choose it. Secondly, in order to share your comments and questions throughout the webinar, we'll be very eager to hear them. Please use the messaging function on the right-hand menu bar. On my screen, it's the second icon down, and you can click on it, and that'll pop up a menu where you can enter your question or comment. Our team from the Global Partnership and IDRC are watching closely. They'll be collecting those questions, feeding them back to me so that I can ensure that we get all of your questions in during the webinar. We won't be taking participants off mute, I'm afraid, to ensure smooth running of the webinar, but we'll be very diligently looking at all of your questions. And finally, for our outstanding speakers, a reminder to speak slowly so that the interpreters can catch all of the very important details in your comments, in your remarks. So before we go on, I just want to double check with Karen Bett, my colleague who's running the webinar in the background, to check if I've missed any important housekeeping detail.
All clear, Jenna. Nothing missed. Thanks.
Wonderful. Okay. So as I said, we are very excited to be here today. We'll start with opening remarks from Montasser Kamal, the program lead of maternal and the Maternal and Child Health Program at the International Development Research Center, where the Center of Excellence for CRVS Systems is hosted. Over to you, Montasser.
Thank you very much, Jenna, and it's a pleasure to be here with you today. Hello, everyone. I'm Montasser Kamal, the program leader for the Maternal and Child Health Program, housing the Center of Excellence for CRVS Systems at the International Development Research Center in Ottawa, Canada. J'ai le grand plaisir de vous souhaiter le bienvenue aujourd'hui.
You here today, and to also thank you for having participated or participating in this second webinar in order to be able to share any news, new results with regard, and to also establish the link between the registration of civil status and the social protection system and the practices of 5 countries.
For joining this second of 2 webinars to share the findings of our new publication titled The Nexus Between Civil Registration and Social Protection Systems, 5 Country Practices. Today, we are focusing on how the nexus between CRVS and social protection systems has supported the distribution of emergency grants during the current COVID-19 pandemic in Argentina and in South Korea. In case anyone joining us today, we want you, who was not with us for our first webinar on September 10th, allow me to offer some brief background. The publication was launched in English, French, and Spanish in July and builds on the recommendations from the conference, the Center of Excellence, co-hosted with UNICEF and WHO on innovations in CRVS systems in February 2018. To fill a knowledge gap in how CRVS systems can provide pathways to social and economic inclusion. This publication brings attention to the experiences of 5 countries that are geographically, socially, and culturally very different from one another, and that have all worked to strengthen their CRVS civil registration systems as a means for promoting inclusive development. The aim of the publication is to provide guidance to policymakers and professionals working in the fields of civil registration and social protection, and particularly those keen to strengthen the connections between these 2 systems. The relationship between civil registration and social protection are mutually reinforcing. Both systems need to interact and work in tandem to function optimally. On the one hand, individuals without trusted identity credentials cannot normally access social protection benefits. For example, in many countries, women are less likely to hold identity credentials such as ID cards or even birth certificates. As a result, they are less likely to be able to open bank accounts or access social protection benefits, inherit from their spouses or other family members. Being undocumented is equally devastating for young people, for example, who are, as a result, are being denied access to education or jobs if they're missing the identity credentials. On the other hand, social protection schemes provide incentives for individuals to register their vital events, births, marriages, deaths, divorces, and deaths. But at the same time, governments need to be able to trust these identity credentials and documents issued through well-functioning civil registration systems to limit inefficiencies and corruption in the distribution of social protection benefits. This makes well-functioning civil registration and social protection systems critical to achieving the Sustainable Development Goals. During and in post-COVID-19 era, the alignment between these 2 systems is more important than ever. The COVID-19 pandemic has negatively impacted millions of people across the globe financially, and governments need to be able to identify and manage the distribution of grants and benefits swiftly and efficiently. By May 1st, 2020, at least 159 countries had planned or had ongoing social protection measures in place to respond to the negative effects of the pandemic. However, many of these countries that many of you know, do not have well-functioning or digitized civil registration systems that produce up-to-date identity credentials, which governments can rely on for the distribution of these benefits to reach those most in need. Si je peux être franc, le gouvernement ne peut pas.
The governments can't respond to the needs of people who don't exist in the official archives. And the governments need to have demographic data, specific demographic data, in order to plan and supply these services in an efficient fashion.
They cannot access the services designed to protect them. I end here for now. It is with pleasure that I hand this session over back to Jenna Slotin from the Global Partnership for Sustainable Development Data to introduce our distinguished presenters in today's session. Thank you very much.
Thank you, Montasser. Excellent scene setting for today's discussion, and really looking forward to hearing the insights from the compendium, from the different case studies, and really thinking about how important it is for inclusion to have those comprehensive civil registration vital statistic systems, and to have good numbers for planning and good data on the population to run effective social protection, especially at this time. That's certainly where we're coming at it from the Global Partnership. So without further ado, we're going to turn to our first speaker, Mia Harbitz. Mia Harbitz was the lead sort of author, project lead on the whole compendium, and will be providing sort of overarching findings and reflections for today's discussion. Over to you, Mia.
Thank you, Jenna. Hello to everyone. It's a pleasure to be with you this morning or afternoon, wherever you are. If you could please put up my presentation, I'll start. Like Montasa said, being registered and having an identity credential is in itself pointless unless this facilitates access to social protection systems, civic rights, and which in turn contributes to better conditions for the individual, as well as socioeconomic development for the society as a whole. Next slide, please. It can be argued that the French were the first to institutionalize modern civil registration by moving the registration of births, marriages, and deaths from the church to the public or municipal sphere in 1792, with the objective of registering the whole population. In modern times, with the passing of the Universal Declaration of Human Rights in 1948 and subsequent conventions such as the Social Security Minimum Standards Convention of 1952, the International Convention on the Elimination of All Forms of Discrimination Against Women of 1979, and the Convention of the Rights of the Child of 1989, really put a more focused and comprehensive approach on legal identity and social development and their mutual importance. The September 11th attacks in 2001 set in motion a whole new interest in uniqueness of identity, but from a security point of view. Coupled with the advent and spread of the internet, there was also a surge in the interest in digital identity and increased need for trusted and trustworthy authentication of identity. During the following decade, many development organizations started showing interest in the importance of civil registration, identity, civil identity, and vital statistics. Fast forward to 2015 and the SDGs that focuses on social development, but also takes governance and legal identity into considerations as conditions for sustainable development. This is evident because 72 of the 232 goals, 232 indicators directly depend or are related to target 16.9 that calls for legal identity for all, including birth registration. Next slide, please. So how do countries progress from ratifying convention to building more inclusive societies? It is difficult, if not impossible, to put a number on the costs of lost opportunities for people, not to mention the diminished planning capacity and loss of revenue for the state due to under-registration and, as a consequence, lack of vital and demographic statistics. The countries with the highest estimated percentages of undocumented or non-registered residents are also among the most fragile. These tend to have the weakest institutions and the fewest resources to break the cycle of invisibility, exclusion, and poverty for those without credentials. And there are an estimated at least 1 billion people without legal identity, according to World Bank research. Most governments are keenly aware of the needs and conditions that have to be in place for favorable socioeconomic development. However, balancing effective governance with capabilities to meet society's demands requires prioritizing resources and institution building, which may be a tall order for many countries. It is a balancing act all the way. Good governance is at times more of an art than a science. And politics are known to get in the way of good policies from time to time. With that said, there is no size-fits-all model that will break the cycle of exclusion and poverty. But two elements must be present: capable institutions and timely and good quality statistics. The investment cost can be considerable, especially and unfortunately, because there has been a tendency to see technology as the panacea to increase civil registration and ensure access to social benefits and social protection schemes. But without the legal framework and institutional capacity, investment in technology will in most cases result in lost opportunities. Our 5 country cases clearly demonstrate the importance of building both civil registration and social protection system from the ground up. Next slide, please. With this compendium, IDRC and the Center of Excellence for CRVS made the decision to move from anecdotal evidence to document successful practices that improved access to both civil registration and had a positive impact on social development and poverty by using civil registration for verification purposes so people could access social programs. And why these 5 countries? Like Mutasa pointed out, they are culturally, politically, and geographically far apart, but they have 5 common strategic elements that are worthwhile looking closer. Most importantly, in these 5 country cases, the governments recognized the problem and sought to solve it, relying on own resources. In particular, they saw the role of civil registration not as a political concern, but as a matter of state policy. Next slide, please. As Jenna said, on September 10th, we had the opportunity to hear about the Chilean, the Namibian, and Tunisian experiences. Chile is a pioneer in the introduction of social policies to foster social inclusion. When a democratic administration succeeded the military dictatorship in 1990, reconstruction was based on a social pact, a national policy that fostered a new relationship between the state, the private sector, and civil society. and built on people's identity. Namibia, from the beginning, from the independence in 1990, there was a high level of commitment to reduce poverty and include people. With the implementation of a series of national policies and strategies. In practice, this has resulted in birth registration of children below 5 years of age to 88.4% in 2004. Death registration stands at 93.7%, and 82.9% of the population have identity cards. These identity cards are linked to the civil registry and the biographic information that is registered there. The strengthened civil registration and identity system played an important role in giving citizens improved access to direct cash transfers and thus reducing poverty from almost 60% in 1990 to less than 20% in 2019, according to the IMF. In the case of Tunisia, in addition to political will, there was also the will to invest in civil registration and social programs in parallel. There was an undeclared contract between the state and the communities. Their involvement in the registration effort process in exchange for and promise to improving living conditions. The government delivered by investing in education and health and created a very positive environment for registration. The latest survey data available show that the share of those living at the lower middle income poverty line of US $3.2 per day fell from 9% in 2010 to 3% in 2015, according to World Bank data. Next slide, please. We cannot speak of inclusive development, social inclusion, or financial inclusion if we cannot guarantee a basic human right, such as the right to a name or access to basic rights and social benefits. To strengthen the case for evidence to support cases where there is political will but may not be the institutional and administrative capacity, it's important to continue to foster applied research and shared knowledge. I should mention here that the Center of Excellence has created a resource library that contains publications related to civil registration and vital statistics that they created and are building. So capacity building is really important, and at some point knowledge must become policy. It's also really important to manage expectations. In real life, changes can get messy. Agreements on change have to be agreed by and multilateral among and between institutions and agencies in a government structure. And this takes time. Another aspect that takes time is that both the population and the private sector has to be involved and participate. Next slide, please. Ensuring having an identity has always mattered, and ensuring a legal identity through civil registration and civil identification, in addition to ensure access to rights, services, social benefits, and civic participation is what the governments in the 5 country cases of this component have done. A stronger link between trusted identity systems and social programs and distribution of benefits and services is more important than ever during the COVID pandemic. Not only because universal registration of vital data yields invaluable vital statistics for decision-making, but because worldwide, more than 250 million people are likely to face life-threatening levels of food insecurity, according to the World Food Programme. Since many, if not most, social assistance programs require positive proofs of identity, the role of the civil registry is more important than ever. I thank you for your attention, and we look forward to learn more in detail about all of this in the coming presentations. Thank you.
Thank you very much, Mia. That was an outstanding foundation for our discussion today and a great presentation. Really a lot of helpful foundational pieces of information on that relationship between civil registration and vital statistics systems on the one hand and social protection on the other. Just a quick reminder on language and translation. As you can see in the bottom left-hand corner of your screen is where you select language. The floor language is the one that you're hearing right now from me, so that's English. But if you would like to listen in French or Spanish, you can select that. Our next presenter will be speaking in Spanish, so anyone who wishes to listen in another language will need to make that selection. A quick reminder to all of our speakers that they have 10 minutes for this first presentation and then we'll have much more time for Q&A as we go, and we want to preserve that time. So now we're going to move on to our next speaker, Maria del Carmen Tamargo, who conducted the case study on Argentina for the compendium, and will share the observations from that case study. Over to you, Maria.
Bueno, buenos días a todas y a todos.
Hello, good morning, everybody. First of all, I'd like to thank IRDC for having invited me to collaborate on this compendium. Thank you, Mia Harvitz, for inviting me to do this and also to participate in this webinar. Just to present briefly key findings and talk a little bit about the relationship between civil registry and social protection systems and identity in Argentina. Please move on to the next slide. Thank you. So the current situation in birth registry and documentation in Argentina is satisfactory when talking about the general region of Latin America. The under-registration of births in Argentina is around 2% currently, which is lower than the percentages we see in other countries in this region. Another interesting bit of information is that the majority of births are registered in the same year that they happen. About 91% are registered in the same year of birth.
Oportuno. Sin embargo,
nevertheless, our country, it's a federal country. It's a very heterogeneous country where we can see big inequalities between regions of the country and the provinces. And this shows that in those provinces where there is a significant percentage of people in poverty, the probabilities of a child in poverty of obtaining or not obtaining their legal identification, it's 2 times, 5 times less that they have a better socioeconomic situation. These strong inequalities are also seen in a unequal development of the institutional capacities and technological capabilities of the provinces, and specifically in their civil registries. The next slide, please. To do this draft or this case study regarding Argentina, we have taken into consideration the last 2 decades. You would ask yourself, why the last 2 decades? Because since the beginning of 2000 in Argentina, there is a reconversion process in the criteria for the development of public policies, as well as to rethink the strategies that are linked to ID and identification and identity. From the year 2000, we established the focus of the right as a primordial axis of the policies as a whole. This goes beyond that if the effects were satisfactory or not, but this focus is sustained throughout the years of this last 2 decades, even in a political change of government that have had different political point of views and political orientations that are different, and that makes their policies different. What have been the key actions regarding the legal identity? Giving free the first document to all children and teenagers, modernizing the whole identification system, and to be able to have their ID out, and to decentralize the centers of civil registry and identification registry throughout quick document centers, of installing digital offices and shopping centers, as to obtain their national identity document as well as their passport, and the strategy of mobile unities to reach those communities that are further isolated in the urban sites of Argentina. Another very relevant action of this was that in 2019, they provided they extended the period of enrolling birth to make this through an administration way to do the national identity card up to 18 years of age, solving problems that were coming from behind of the children that were not registered at their due time. Another important thing was a convention signed between Renacer and the Secretary of Human Rights and Cultural Pluralism that was there to guarantee the access of all of the identity and identification of the indigenous communities. And a series of social policies and social protection policies that they had as their main key identification to have a national document of identification. Next slide, please. Here is where we can see the existence of this synergy between the legal identity policies and social protection. Because having a legal identity is part of the requirements to be able to have a series of benefits, social benefits that is, that go alongside consolidating 2 social protection systems that work in Argentina parallelly. One is the transfer of contributions, which is the one that reaches all the workers, all the formal workers that receive as a direct wage through family revenues, family allocation, sorry. And there is a second system of which is destined to those informal workers, the unemployed, the people that are in a situation of poverty, and people that have children younger than 18 years of age. This transfer that are not contributable, the clearest example of this is the allocation per child, which is a program that comes from previous experiences in Argentina of setting programs for conditional income. So the access to the benefits provided is having a birth certificate and a national identity document. Likewise, and this is why we talk about this synergy and this link, the modernization of this civil registry system in their infrastructure and in the technology and management, as well as having legal frameworks that would make it more flexible to obtain the birth certificate and the national identity card. They have created a virtuous relationship to having access to the rights. The next slide, please. So what is happening today? And this is like an analysis that is still undergoing. We have 6 months in Argentina of quarantine or lockdowns or restrictive measures regarding the pandemic. And I mentioned before that our country, the civil registries are by province, so each province has their own right to take decisions. And we can see how the different decisions arise amidst this pandemic. At a national level, the quick documentation centers of RENAPER, they stopped working because it was considered not an essential activity, but there wasn't an online option. In the opposite, in the city of Buenos Aires, the registry of births is still carried out in the public and private centers where people were born. And there it was able to do all the paperwork online, giving a delay to a legal framework of registering at a timely manner of birth. Moreover, there was a set of measures of social protection measures that were reinforced and that were designed amidst the pandemic to help the areas that, due to the restrictive measures, could not be generating income. As you have seen, Argentina has a high level of informal workers. Thus, this is an area that needed to be helped by the state because the restrictive measures didn't allow them to work and generate their own income. So the IFE, by its acronym in Spanish, was the Federal Emergency Income, which has been one of the policies made for these workers that are informal workers, and as well to help the emergency for work and production, which is a subsidy for companies to cover 50% of the salary, the continuity of allocation, universal allocation per child, reinforced by a wire of income, which is helping also with a food cart provided to purchase food specifically. Next slide, please. What we have been able to see as what happened by the IFE, for its acronym in Spanish, which is designated for informal workers, the government estimates that it will be approximately 3.5 million people, and the amount were 11 million people that were enrolled, which were leaving active only 7 million. This showed that there was a lot of problems that we could link to interoperability, how the basis of the taxing system, of the social protection system, of the financial activities don't have communications amongst each other, as it was warned of the existence of multiple mistakes in these databases because the data was not updated, because they were not complete. So that this fragmentation of the database, this huge informality that doesn't say that these people are not undocumented, but that these people are not registered properly, and there are a lot of mistakes in their data. This showed a series of problems of interoperability. One of the responses generated, because this launch is recent, it was actually launched in September to try to cover these faults, is to launch a federal platform of a digital certification of vital signs, which would be in charge of Renacer. I'm talking in future because we are just talking about the launching, and it will provide digital information in real time, which would provide information for the public policies to design identity policies and financial inclusion policies. And it's going to bring about a bringing together process to share information between the national provinces and financial entities. We could also say that the synergy that we can see in this last 2 decades between the legal identity policies and the social protection policies have contributed to stop or reduce the intergenerational reproduction of documents. And that identity has become a basic need to distribute and provide and grant social benefits. It has also made it more transparent in the allocation of these benefits. And I believe that a very important data to take into consideration in a country such as Argentina, that has turbulent politic and economic situations, has been a linking model between the political models that has lasted, and it's been long lasting despite the changes of government and the critical situations that affect the economy and affect the people's lives. What we need to solve now, it's not small, and it's something that has to do with this imbalances that I spoke about at the beginning, or these inequalities that I spoke about between the institutional capacities of the civil and provincial registries to guarantee conditions of equity in access to social protection systems to all in Argentina. I thank you, and I hope that I was clear, and I hope I didn't speak very fast. And I am available for any question that you wish to ask when we reach that time.
In Argentina. It's so interesting to reflect for a Latin American country and the history in that country of its trajectory. Now we're going to move to a very different geography, and we're very much looking forward to hearing from Professor Hee-Jun Song, who will share with us the findings of the South Korea case study and the experiences there in response to COVID-19. Just a quick reminder, of course, to select your language from the language bar at the bottom, but also if you're having problems with the audio, the technicians recommend that you refresh the page You won't get kicked out of the meeting, but it will allow you to improve the sound. Thank you. And over to you, Professor Song.
Thank you, Jenna. Good evening, everybody here in Seoul, Korea. I am Hee-jun Song. Next slide, please. Yeah. Korea's CRVS systems consist of family relationship registration, resident registration, and population change survey. They are under different jurisdictions, but implemented together at the community centers of local government. Resident registration as the national ID system aimed to manage labor force migration with the launching of the first 5-year economic development plan in 1962. Rapid economic growth of Korea is indebted much to the NID system that helps the government collect information on job, housing, education, and healthcare of migrants. NID card and number system was established to strengthen national security and monitor espionage after the incident of North Korean Special Commanders infiltration targeting the presidential palace in 1968. While the primary policy aim of the NID system in 1960s was economic development and national security, it includes now the provision of integrated social services. Next slide, please. Resident registration verifies a person's residence registered in a specific local government area. An ID card containing a person's NID number, address, and thumbprint is used by public officials to verify a person. An ID number given to a newborn baby contains information on the date and place of birth and gender. It is unique, unchangeable, exclusive, and has a lifelong validity that can be changed only in exceptional cases like exposure to a serious danger to safety, health, or property. Information sharing system intermediates civil applications data between data holding and data using public agencies. It promotes managerial efficiency as well as citizens' convenience because it reduces accompanying documents to civil applications filed to the public office. Information sharing requires the prior consent of the applicant who files civil applications to protect the right to self-determination of personal information. As NID number became a convenient identification tool at the initial stage of e-government and e-commerce, abuse and infringements occurred frequently. The government revised the laws concerning personal information to set up strict regulations on the collection, storage, and use of NID numbers and permit them. Next slide, please. Now I'll talk about the uses of the NID system for social protection. Korean government aims to build social safety nets that secure healthy and stable lives of all people. When a new birth is recorded in the resident register, local governments provide various child care subsidies and benefits to promote new birth in their area. National Education Information System provides information on the notice of school enrollments, meals, vaccination, etc. with the students and their parents. They can access the system using their own NIDs. The government operates 4 kinds of compulsory social insurance for adult workers, such as health, pension, and unemployment as a social safeguard. In addition, the government operates social security programs like basic living security and medical benefits for the vulnerable class. Let me introduce 2 social protection programs, national health insurance and public assistance to poor people. Next slide, please. National health insurance, as a single insurer, provides a universal coverage with every member of the population, including the employed, self-employed, and their dependents. Health insurance policyholders must pay insurance premiums to National Health Insurance Service and pay their portion of the insurance payment to hospitals and pharmacies. Co-insurance rate is patient payment at 20%, insurance reimbursement 80%. Hospitals and pharmacies provide medical services to the insured people and ask reimbursement for the service expense to the health insurance. An ID number is used to confirm a person's identity in every process of medical services of hospitals, of pharmacies, and health insurance institutions. Next slide, please. 5 years ago, Korean society faced a series of tragic incidents occurred in welfare blind spots. A North Korean defector mother and her son starved to death, leaving no food and drink in the refrigerator. Just before that incident, a mother and her 2 daughters made a suicide, leaving some money for the last monthly rent and utility bills to the landlord. The government launched immediately the emergency monitoring system for low-income households. 27 kinds of data held by 15 public agencies in charge of electricity, running water resources, liquefied natural gas, etc., were collected to identify the households that did not use those public utilities and defaulted on monthly payments of social insurance premium for several months. After screening collected data, the government selected qualified crisis households and delivered customized services. Also, social service information system was launched to monitor welfare blind spots, as well as crack down on duplicate applications and illegal recipients of benefit payments through the collaboration of welfare-related organizations. An ID number is a key identification means to collect the data of relevant agencies and extract proper information on the needy families. Next slide, please. Now, let me talk about COVID with CRVS. Although many super spreaders came from neighboring China, Korean government seems successful at war with the pandemic. As of today, among 50 million population, cumulative confirmed cases are about 23,000, and the deceased are 390. Korea Disease Control and Prevention Agency plays a key role in tackling the pandemic using systems of health insurance, information sharing, and NID. The governance of the agency was strengthened after the outbreak of the Middle East respiratory syndrome in 2015. The mayors gave lessons such as distancing between hospital beds, quarantine, emergency network, and medical supplies. Korea's quarantine model consists of 3 steps and 3 support policy cases. The first is testing and confirmation using drive-through walk-through screening clinics. The second is tracking COVID spread using credit card transactions, etc. The third is treatment and quarantine using a mandatory installation of a mobile self-quarantine management app. Support policies include emergency relief programs, mask rationing, and self-quarantine care packages. Next slide, please. This figure shows the overall workflow of tackling COVID with the CRVS. The first action of the government is to set up drive-through, walk-through screening stations and border screening at airport. They increase easy access of people showing fever or cough symptoms to diagnostic tests and promote early detection of confirmed cases. If positive in testing, they are transferred to hospitals or for treatment. If negative or asymptomatic, they are subject to active monitoring for 14 days by installing self-diagnosis app and being provided with essential care packages at a low price by local governments. Self-diagnosis results of symptoms and status updates of those people in quarantine are transmitted regularly to electronic medical records of the agency. Second, the government tracks the source of infection through prompt epidemiological investigation and contact management using medical records, mobile GPS, credit card transactions, electronic visitor registration system like QR code, etc. Third, the government provided the emergency relief payments of cash deposits to bank accounts and credit debit card points to invigorate the economy and console people suffering from economic hardships. Facing the shortage of face masks in the initial stage of the pandemic, the government introduced the mask rationing system with 5-day rotation to prohibit the hoarding. Those born in years ending in 1 and 6 were permitted to purchase masks on Mondays, 2 and 7 Tuesdays, etc., at pharmacies nearby their residence or office, after tracking their NID numbers through the health insurance network. In every process of testing, tracking, treatment, and social support, NID card, driver license, and/or cell phone is used to certify a person's identity. Last slide, please. Now, it's time to conclude my presentation. NID system plays a key role in administration in Korea. Information sharing promotes the government-wide collaboration for a social protection pool. But social concerns are rising around the excessive monitoring and the surveillance. There is a trade-off between values of personal rights and prompt ending of the pandemic. It is therefore important to aware that the NID system is very convenient but sensitive personal information. I believe that trial and error experience and lessons of Korea's CRV systems in the COVID pandemic times are worth sharing among countries. Thank you all for your attention. Thank you.
Thank you, Professor Song. Very, very interesting to hear the experience of South Korea. And we've heard a lot, I think, in the media about the relationship between those digitized systems, record keeping, and social assistance for the COVID-19, as well as contact tracing. Very interesting to hear it discussed here. So now we'll move on to our final presentation before the Q&A. Dr. Jacqueline Maza from Johns Hopkins University. Over to you. Thank you.
Thank you, Jenna, and to IDRC for the invitation to speak and to comment on this really interesting publication on social protection and identity. And I also want to particularly thank Mia Harbitz, who brought me into this presentation and enabled me to see the great advance on the issue of identity documentation. Many years ago, I was on the first Inter-American Development Bank missions on the under-registration of birth in Peru and Bolivia. And at that point, they were often talking, what are these senoras talking about when it comes to birth registration? And this compendium really shows the major advance that has been made on the issue of identity documentation. And it's really the first publication, and you can go to the next slide, on exploring identity documentation as social protection. But it really takes a wide view of identity in terms of linking identity with a string of other rights. If you could turn to the next slide, I'm going at the end to be talking about particular research on COVID-19, social protection, and migrants. But for now, I just wanted to point out a few things about the compendium. It talks about social protection and identity documentation as a two-way street, but in a very novel way. First, looking at how social protection benefits are really a concrete door into incentivizing people for birth registry and identity documentation. And on the other side, each of the case studies really show how the identity documentation is really helping innovate, make more efficient the delivery of social protection and the coordination of benefits among social protection. We'll move to the next slide, but just to point out that the 5 case studies in this compendium are really quite a range along the development scale, a range along the issue of national identity in different country contexts. And I think that's very noteworthy about the publication. I took 3 particular conclusions which I wanted to present to all of you that come out when I read the compendium. And first is the issue of social protection offering a tangible and what I would say continuous incentive for increasing identity registration. And all of the cases, but particularly Argentina, really impressed me on just how much the linking of birth registration to social protection has dramatically supported the increase in birth registry in Argentina. As well, in the Tunisian case, when it talks about the link with medical insurance at birth and how that assists birth registry. I make the concrete point about continuous incentive because I had worked in the case of Haiti and birth registration, and in that case, it was a single point in time, that is increasing birth registration to enable Haitians to register to vote. It was a single 1 point in time registry rather than the much more effective over time use of social protection, because it provides, as I mentioned, this continuous incentive for birth registry. The other noteworthy conclusion I wanted to point out is that this single identity number shows great utility in the different cases. First, about driving better services and benefit coordination and improving the ability to more automatically identify people for benefit qualification. And this you see in the case in Chile, where 32 different registries were coordinated under a unique country number, and it enables the Chileans to identify who is eligible for services. As well as the Tunisian case showed this multiple agency disorder at first before the unique number helps transform and reform. And finally, when it comes to the issue of reforming social insurance and identity systems, the 5 cases really show how diverse are the country conditions and preconditions for the reform on identity. And what really impressed me is the good results that are shown with very challenging preconditions. And if you look at the case of Namibia, which is really a remarkable transition, which had virtually little rural birth registration and move forward in this very challenging condition, as well as the case of South Korea, which started post-war in '53 and then moves forward to one of the key adoptees of a unique ID number. And the South Korean case that was just presented is really it's really quite impressive when one looks at how evolved the South Korean system is. But what's interesting in the case studies is that it starts from the standpoint of what appears to be a very challenging condition. And in development literature, this reminds me of the same way we look at big moments for economic reform. That is, economic reform, if we look at cases in Southeast Asia, began in the midst of financial crisis or in the midst of particular difficulties. That is, there are moments when we can see the political will that pushes forward reform, and this is really seen in this identity documents. If you could move to the next case. Right now I'm going, the next slides, excuse me. Now I'm going to present a little of my own recent research for an upcoming article about the case of Venezuelan migrants and refugees in South America under COVID-19. And at this point, I just want to recognize my superb Colombian research assistant, Nicolas Ferrero Villarreal, who is also here as a participant for this really groundbreaking research done from afar. So let us, this is a particular challenge in how to get assistance to what is, if you can see in this map, one of the world's largest migration crises at the moment. That is, what happens to a migration crisis at the same time that the pandemic hits. If we can look at these numbers, the record 5.3 million Venezuelans who have left Venezuela, 4.5 million of them in South America. This rivals Syria as the world's largest migration crisis. When we look overall, there are particular vulnerabilities of this migrant population, and you can see from this map concentrated highly in Colombia with 1.4 million and in Peru with just under 1 million. But what happened in the lockdowns? We have principally migrants often in vulnerable housing, many in temporary shelters as the numbers of migrants increase. We saw over the course of the pandemic a high rate of evictions and overcrowded shelters which turned migrants away. You heard in the case of Argentina, the issue of trying to cover through social protection informal work. This was the real challenge in Latin America. Rates of informality are from 40 to 60%, but among migrants, they are closer to the 75% of Venezuelan migrants in Latin America working in the informal sector, largely state services and farm work. With the problems of being evicted from housing and having no place to shelter, we do note a return migration factor into Venezuela, estimated 30,000 to 95,000. Again, a relatively small percentage of the 4.5 million in the region. But the stories of those walking back to the Venezuelan-Colombian border, crossing into Venezuela, and then being resheltered in very unclean and unsafe facilities under the Maduro administration shows you the particular vulnerability of migrants under COVID. We see as well a rise in xenophobia and discrimination against migrants as disproportionately carrying the virus, and issues of limited access to healthcare. If you can move to the next slide, I want to just talk a little bit about social protection as it became the key tool of the pandemic in Latin America. And again, you heard this in the Argentina case study. That is because of the high rates of informality, social protection, the expansion of social protection to those who are now newly poor or unable to earn income is the principal vehicle of getting emergency assistance to families in Latin America. Here is where we can see the decades of investment in the conditional cash transfer programs and in civil registration systems really had a major payoff in identifying and delivering cash aid to what I call the new poor. And it enabled, particularly if we look at the case, for example, of Peru, that is to expand because of the civil registration system, they were able to easily expand to provide cash assistance to those who previously did not qualify. In Peru, the estimate is up to 76% of the population was covered under using the civil registry system, extending the social protection system. So we see a number of good practices, although difficult bureaucratically, as you can only imagine, but the registries did help expand coverage. Brazil introduced a new online feature for registry. Ecuador used census data to fill in some gaps. And we really saw the expansion of civil registry in Peru and in Chile using its social registry again to expand benefits. If we turn in the next slide, thank you, to the issue of what happened for migrants in the 6 top receiving countries, we're going to see a very different perspective on national coverage of migrants under social assistance during the pandemic. And if you can just move to the next slide, because I have more of the conclusions, I will provide you with this table. But here we see quite a range of the ability for migrants, non-nationals, to qualify and access national social protection programs. Only in the case of Brazil was the poor allowed to qualify for additional cash assistance, regardless of their nationality or migration status. Even if we can look at this as the best case, that is of universal coverage of a pretty generous increase in Bolsa Familia, what we find in the Brazilian case is that the poor and migrants who could not access an online system were left to qualify at local registry offices, which you can only imagine were overwhelmed under the pandemic. So even in the best case, we have issues of the ability to access local offices. The mid-range cases, Colombia, Argentina, and Chile, is that migrant populations qualified only as subgroups under the national national social protection frameworks. In Colombia, only those who had the PEP, which is a temporary work permission, were eligible then under the social insurance protection system. But what did that mean? Only about 37% of the 1.4 million Venezuelans in Colombia have this work permit. And so as a result, the majority of Venezuelan migrants were not officially allowed to access the Familias en Acción program. In Argentina, they set a agreement with that migrants had to have shown legal residence for 2+ years in order to qualify for CCT benefits. And in Chile, they had to have been previously registered in the social registry. Again, this meant limitations on, and particularly on the poorest of Venezuelan migrants to qualify. In both Ecuador and Peru, non-nationals were explicitly prohibited, or in the case of Peru, you needed to have a national identity document to qualify, which were only available to nationals. What did this mean? This meant that first, UN agencies and NGOs did try as well as they could step in to provide smaller social assistance programs, food programs. Migrants did have support from national governments in targeted assistance. But again, we can see how had migrants been more systematically provided identity documents and information under the use of the CCT programs for assistance under emergency could have been much smoother and much more efficient. So if you could just move to the last slide, I just want to conclude a little bit and thank you all for your for listening. This is a picture then of Venezuelan migrants traveling out of Chile in this case, and you can see in my presentation that we are just beginning to learn how social protection can be converted into an emergency instrument. And in that sense, we have to think more comprehensively about whether larger numbers of the population, particularly non-nationals, can be included in the information systems, which would allow much more efficient delivery. Thank you very much for your attention.
Thank you, Professor Massa. That was really fascinating and so interesting to hear that focus on migrants and non-citizens or non-residents. Well, we have heard such deep and interesting presentations. We wanted to move to Q&A. We have a little less time than anticipated for the Q&A. And so what we've done is we've collected the questions. I'm going to put one question to each of the speakers. We'll go to each speaker in turn and ask you, I'm afraid, to restrict your responses, just 2 minutes each. That'll then allow us time to come to Montaster for some final remarks. So a question to Mia. Perhaps if you could reflect a little bit on how, I think what some of the listeners heard, they were reflecting on their own country knowledge or experience about where birth registration is low or perhaps has gone down because of the pandemic. How perhaps is that being addressed through some innovation in CRVS systems and the relationship to social protection? And then for Maria, we had one question about what happens at the documentation centers that you highlighted in your presentation for Argentina, and also what are the causes of the 2% under registration rate and the 9% not timely registration rates that you highlighted in your presentation. For Professor Song, you touched on at the very end of your presentation some sensitivities and questions around the treatment and handling of personal and sensitive data. In the South Korean case, we have the example of so many efficient connections across systems and databases, particularly then linked with contact tracing and other methods of surveillance for the COVID-19 pandemic. Can you talk a little bit about how in South Korea they're handling those challenges around sensitive handling and management of data? And lastly, for Professor Maza, I wonder if you could reflect a little bit more on how social protection can happen in the absence of birth certificates or registration, perhaps reflecting on the experience, further on the experience of migrants. So those are each of your questions, and we'll go in that order. So starting with Mia Harvitz first. Please, Mia.
Thank you, Jenna. Countries with low birth registration rates, and I would also like to mention that it's not only birth registration, it's also about marriage, divorce, and death registration to have a complete picture of a country's population. The best examples of countries moving from very low birth registration to achieving very high levels, if not, on par with developed countries. The registration procedures have been linked to incentives. And the incentives could be access to social programs. It could be access to stipends. It could be access to getting a pension from the state. And these have been successful experiences in a number of countries getting birth registration up. During the pandemic, it's really a challenge because getting to an office, having to stand in line in an office, that requires a lot of consideration on part of the civil registry so they can actually manage the lines of people wanting to register. And also be more flexible about the rules. In many countries, you are obliged by law to register a birth or any vital event within a certain number of days. We have seen that has been put in more flexible terms during the pandemic as well, making it easier for people to comply when they are able to get to an office. The countries that do have the possibility of collecting data, the whole notification process for births and deaths in hospitals are in a better position. But as far as countries where this is not yet possible, to be more flexible about the rules, administrative rules for registration, and also linking to any benefits that countries have put in place to respond to the urgencies and the needs.
Thank you. That's excellent. Thank you, Mia. So over to you, Maria, to answer your question.
Bueno, sí. Indudablemente.
Well, undoubtedly that 2% of under-registration of births is related to people in who are socially vulnerable. On the last study that was used to develop the compendium, it was done by UNICEF, and there were indications that 2% was concentrated amongst young mothers, teenage mothers, who live in isolated areas and in highly social vulnerable conditions. This series of strategies that we've implemented, from RENAPER policies themselves to provincial measures and mobile units and other measures that have been able to arrive in these areas, have been able to mitigate the problem. Additionally, there are differences between different provinces. In Buenos Aires, there's a program called The State in Your Neighborhood, El Estado en tu Barrio, which has helped to advance the entire series of social protection programs. It's called the Ventanilla Única. That is one office, a central office where people can carry out all of these social protection measures and receive services. And if a person who has, for example, given birth in a public hospital, they can't get to the social registry office, the civil registry office, to get the birth certificate, well, then they can go to a central office to obtain the birth certificate and other identification documents. There's also been extension of the legal time period that is allowable for children to be able to register. It's been extended now to 18 years of age. Through administrative means, they can obtain their identity documents without any cost. Usually, if you don't register within a certain legal time frame, then you have to pay fees, and it depends, it varies from one province to another, which in and of itself is a barrier to access for identity documents. Now, with regards to 91% of people who are registered in the same year of their birth, that number reaches 96% when we consider people who are registered after the first year of its birth. So really the rate has reached 96%. And this is concentrated in certain regions of the country, but there are other countries that are still more vulnerable. And again, young mothers are still the most vulnerable, and they are the ones that make up this 2% of unregistered births. So we're looking at more concentrated actions to reach that segment of the population that has been left out.
I have to ask the next two speakers to be extremely brief, I'm afraid, but we're eager to hear your quick responses. So Professor Song, please. I think.
Thank you. Korea is a nation with highly matured e-government level. Public officials use the NID system to ascertain the identity of the individual and to provide basic information for other services, as I said. Public information sharing helps to provide integrated social welfare services to people instead of siloed and stacked services of independent agencies. When the NID
Did we just lose Professor Song? Okay. Gosh, I'm not sure what happened. Apologies for that, and apologies to him for getting cut off. We're very close to the end here, so we're going to move over quickly to Professor Massa, and perhaps we'll get Professor Song back. Please go ahead.
Okay, my quick answer is that there are alternative social protection systems that are the African model of cash assistance, which is largely delivered through cell phone technology and is not connected to a larger system of social protection. And quite honestly, in conditions of high poverty, it works quite well and quite efficiently.
Thank you. That's really interesting, and I imagine that's the subject of a webinar unto itself. But unfortunately, we don't have the time today. So thank you to everyone. We'll move over now to Montasser Kamal from the IDRC, who will share some wrap-up remarks and can also touch perhaps on the gender barriers for registration of vital events and the direct consequences of non-registering births and deaths in a social protection context. So just looking at that gender dimension with his final wrap-up remarks. Over to you, Montaser.
Thank you very much, Jen, and thank you so much for all of our distinguished speakers. This is obviously a webinar that could go on for a couple more hours, but we come to the closing section of this webinar. As today's discussion has shown, the interlinkage between different systems have proven to reverse some of the negative impacts or address some of the negative impacts of the COVID-19 pandemic. The experience in the 5 countries featured in the new compendium offer examples of different approaches governments can take to strengthen their systems to varying degrees. What the case studies today and the compendium show is that all the approaches should be driven by the principle of inclusivity, done through cooperation between government agencies, the removal of barriers to registration through legal and regulatory review and reform, the creation of interoperable databases, and creating community demand and cooperation. A key ingredient for this is the political will by the decision makers and the role of different agencies and civil society in promoting this will for an equal and just society, and the genuine appreciation and the required genuine appreciation and understanding of the mutual benefit that a relationship between CRVS and social protection systems can bring to one another. According to recent data from the World Bank, women in low-income countries are less likely to have proof of identity. On average, 44% of women in low-income countries do not have ID, compared to 28% of men. Without the proof of identity, as mentioned earlier, access to social protection schemes can be denied or diminished, especially for women. This also negatively affects children, and in most cases, or many cases, girls in particular. Some cash grant schemes targeting vulnerable or orphan children, for example, require proof of identity of the parent or the guardian, or proof of kinship. When those don't exist, more and more children live in poverty. This is where the role of the CRVS, of the Center of Excellence, comes in. Le mandat du Centre d'Excellence est de commander, développer, soutenir et
Our mission is to encourage the proper management of civil data, and I'll continue in English or in French.
In French. We recently launched an online directory of experts where you can find experts in the field of CRVS, and that can be accessed at www.crvsdirectory.org or www.repertoireessec.org. Thank you very much for our presenters, Mia, Maria, Professor Song, and Professor Maza, for sharing your knowledge and experience today. And thank you also very much to Jenna Slotin from GPSDD for moderating this wonderful webinar. And of course, thanks to all of you for joining. Have a great day. Thank you.
Thank you, Montaser, and thank you everyone for joining us today. All the best.